Let's talk about the first 30 days of your diagnosis of head and neck cancer. What is that going to look like? Once you have been formally diagnosed by your ENT, you are now going to begin to meet your physicians. Your ear, nose, and throat doctor is the diagnostic physician. Then you are going to be referred to a physician called a radiation oncologist. Your radiation oncologist is going to help to develop your treatment planning and your mapping. You may also be referred to a physician called an oncologist. The oncologist physician determines if you are a candidate for chemo or chemoradiation. This helps the process of the radiation therapy. However, it is not always indicated in all diagnoses. So, we have developed a model to be able to help us understand what is happening with our patients. In this portion of the model, what we are going to do is discuss just the first 30 days of your treatment. Let's go ahead and bring ourselves right in here to that first 30 days. Now, in this model, during those first 30 days, you are going to be meeting many people. It can be somewhat overwhelming. Your radiation oncologist determines what is called the level of mapping. So let's draw out what a radiation looks like. So you'll have your radiation oncologist. They say, hello, how are you today? Most of them are very friendly and they are there to care and love for you and help you heal and move on with the next stages of your life. They are going to basically draw out a map. And the map's your body. Your body is going to receive different levels of radiation via a beam. Your body will receive that radiation from a beam of a machine. That beam is going to send signals to your body to get rid of that tumor. So we've got our tumor here, and we want that guy gone. He is going to get zapped. Now, your radiation oncologist is going to map the fields of your body based on what is called your primary site and the NCCN guidelines. Radiation oncologists have guidelines that they follow, and then they collaborate with other physicians to determine what's the best care for your individualized treatment. Sometimes the care is that of a combination of modalities, whether you are just a radiation patient, a surgery or a radiation patient, or all three, the surgery, the chemo, and the radiation really does depend on your cancer and what stage it's in, as well as the doctors giving you the best chances of survivorship and helping to get rid of this cancer. Now, your radiation oncologist has drawn a map. That planning takes time, and they spend a lot of time to individualize that care specifically for you. So, different parts of your body may receive different beams or different levels of radiation. Those levels are called grays. Sometimes you will see that shortened in terms of the words GY, okay? GY is going to be the level that your body receives to a certain area. Now, why do I care about grays as a speech pathologist? Well, we know that later in life, however many grays you received to a certain field or zone, not only does that radiation do a wonderful job of killing the cancer, but it also unfortunately kills healthy tissue surrounding the cancer. So there's some magical numbers in the literature or science that we as speech therapists, physical therapists, and occupational therapists try to work with. That magical science is around 55 to 70 grays. We look to see, did your body receive 55 to 70 grays? And if so, then there is a consideration for what's called radiation fibrosis syndrome. And so we're looking to see later in life if that is what's causing your symptoms, because radiation will change muscles and the DNA makeup of the muscles progressively over time. So your radiation oncologist will hopefully have a favorite speech pathologist or physical therapist that they refer you to. Next, let's go back to our map. Over here, our radiation oncologist has said, okay, I have our map all planned. You, as the patient, are going to come back and be fit for what's called a mask. So here we are. We are a patient. We're hanging out, going to the beach for the day at the radiation field. This machine is going to specifically send certain levels of those beams to our body in certain areas that our doctor has prescribed. But you will be fit for what is called a radiation mask. Now, any patient that has been through radiation will tell you about their mask. Some patients even keep them and hang them on the wall. The mask is going to fit customized over your body and your head and your neck. That mask is going to help to protect and preserve certain fields that do not need to be involved in the radiation. That mask, every day, you go to treatment 5 days a week, sometimes once a day, sometimes twice a day. It depends on what your doctor has prescribed. But 5 days a week, you go, doop, 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 doop. I'm going to radiation. I'm going to jump up here on the table. I'm going to lay down. I'm going to be bolted to the table with this mask. The mask is going to ensure that the remaining structures of the face and the neck are not involved in the fields of radiation, but also ensure that the structures that need to receive the radiation therapy and the photon or proton beams, depending on your facility, that those are received to your body. So that is going to look like those first 30 days. You may be fit for a mask. You will be referred by your physician, by your radiation oncologist for a fitting, and your treatment will soon begin after your mask fitting. But don't be surprised if your radiation oncologist sends you to a few other professionals. We are here to help you navigate what does this journey look like in your timeline. Through science, through the support of physicians, and a multidisciplinary team, we as providers know how to guide you and what's expected at each step in your treatment. Thank you for trusting us.